now we're going to move to mental health supports for teen parents. And we have two speakers here. One is Ms. Taylor Cumming, who I think is just moving past here now. Looking for her PowerPoint. And I'll just tell you a little bit about her. She's a graduate of the University of Alberta's Bachelor of Arts program, recent grad, 2012, a major in psychology and a minor in sociology. She completed a one-year clinical psychology internship in a psychosocial rehabilitation program at the Centennial Centre for Mental Health and Brain Injury in Ponoka, Alberta. She's currently employed with the Canadian Mental Health Association in Edmonton region as the Mental Health Recovery Facilitator for the Mental Health Supports for Teen Parents project. And we have a mystery lady here, and this is Mrs. Laura Fulmer, who's going to introduce herself.
Yes, so I'm Laura, and I work for Terra, Center for Teen Parents. I've worked for Terra for 15 years now, first as a child and youth worker, and then more recently as a manager in the programs with our partnership at the school. So you'll hear more about our services and the program at the school. So we're here today to tell you about our pilot project, Mental Health Supports for Teen Parents. This is just a couple of our participants of the program that we brought pictures of today. So today's sharing will be around the increased understanding of teen pregnancy and its impact on mental health or mental illness, description of our project, and the successes and the challenges for the past year. So over time, we have seen a decline, actually, in teen pregnancy rates both in Canada and the U.S. I just need to note that the combined birth rate, it's a combined birth rate and abortion rate for Canada, and a combined birth rate, abortion, and miscarriage for the U.S. The Canadian pregnancy rates, they do not include the miscarriage and stillbirth, but it makes up a very small percentage. And to note that 3 in 10 girls will become pregnant at least once before age 20. Yeah, it's quite a significant, and this is an American statistic.
So factors that contribute to teen pregnancy, I don't think that these will be new for anyone here. Poverty and abuse being some really big risk factors. We've also found that teens nowadays are engaging in, or becoming sexually active earlier and using contraceptives less than in the past, and less reliable means of contraceptives as well. And then with mental health, this is actually a statistic from a study that was just published in March, a Canadian study. Young girls 15 to 19 with a major mental illness were 3 times more likely to become teenage parents. So not only does becoming a teen mom impact your mental health, but having mental health concern can increase your becoming a teen mom. Also, sexual assault. Studies show that anywhere between 30 to 60% of teen moms have experienced past sexual abuse. So mental health and teen pregnancy. This is a very conservative number from a Canadian study that 10% of new moms experience postpartum. That's really probably 10 to 20, 25%. And then teen moms are more than twice as likely to suffer from postpartum than other moms. Also found that teen moms suffering from depression are twice as likely to get pregnant again within the first year or 2 after their first pregnancy, which further complicates mental health matters if they're part of. With our population in our program, and we'll get into our program description in a moment, but 48% of our women were either had diagnoses or self-identified with having a mental illness and went to take up the program. So that's 50% of our moms almost. with abuse, 57% of our women have experienced past abuse. And we looked at physical abuse, sexual abuse, financial, emotional, and other. So of these women, 62% experienced more than one type of abuse. And of the clients that I work with in particular, 71% of my clients have reported past sexual abuse and 92 reported physical abuse. So that's pretty significant. So yeah, we'll get into a little bit more about what our program is.
Right. So Terra Center for Teen Parents is a nonprofit organization. It's been operating for 42 years. And we've been in partnership with an Edmonton public school, Braemar, since 1996. So Braemar, they provide the educational component of the program and the career opportunities. And Terra provides the Child Development Center. We have pre and postnatal supports on site. We do collective cooking. We do parenting support, and we offer one-to-one and group supportive counseling for the young moms during the day while they're attending school.
So Braemar is exclusively for pregnant and parenting teens.
Right, exactly. And the age grouping is from age 13 to 19. This year, our average age of our students is 19. We're seeing a little bit older student or parent at the school. Previously, we were looking at 17.1 as our mean age, say about 5 years ago. So we are in partnership with Canadian Mental Health on this project. Edmonton region. It is a national-wide nonprofit serving men and women. There are also multidisciplinary professionals on site of the school. So we have pediatricians come on site, dental hygienists, birth control nurse. We have a well baby clinic. So we have the community health nurses come on site to do check on babies, do their weight and measure, do their immunizations. And now we have a mental health recovery support person. So we came together in about 2012, Canadian Mental Health and Terra, and we applied for funding from our provincial government to the health region for this pilot project. And we were really fortunate to get some money from them for 1 year. And what that consisted of was for staffing and evaluation and some program monies to operate.
So the pilot project, which started last year in 2012, supposed to start in September, ended up starting at the end of November. But it included a 0.5 contract position for a mental health recovery facilitator, so that's 2.5 days at the school. The program was supposed to consist of one-to-one supportive counseling, a psychoeducational, psychotherapeutic after-school group, education for staff, and outreach. We realized very quickly that the initial proposal was very ambitious, especially the outreach component. It's too much to go off-site for one person who's there half a week. And turns out that about 75% of my time is spent one-to-one work with the girls. We were a little lucky because the project started in November rather than September. We could allot some of that money that we didn't use in September and October to add some time, so I ended up being there about 3 or 4 days a week instead of 2.5, so that was a bit of a bonus. The after-school group that we ran, I ran it with the co-facilitator and addictions counselor from Alberta Health Services, and we used the Voices program by Stephanie Cumming. So it's a self-empowerment group designed for young women, 12 to 18, and it's designed for at-risk young women. And we've kind of tailored it a little bit to include that parenting piece, since most of our moms, a few were pregnant. But some of the the theories of framework in the program: psychological development, attachment, resilience, addiction, trauma, and there are a number of therapeutic approaches. The program was a little bit long. We wanted to run it once each semester, but with the constraints of the semester, the program was a little bit long, so we kind of had to condense it into about 16 sessions. Still managed to cover all the material. Our group was after school. We provided dinner, childcare, and transportation for the girls. Yeah, and it was really well attended, really well received. So, and these are some of the results that we saw in both the pilot and what we're seeing right now. So, in the pilot project, I saw 32 students from December to June. And this year, from September to April, and the year isn't over yet, I've seen 48, which is over a third of our school population right now. We found that students that did have appointments with me or see me on a fairly regular basis, the students that have identified mental illness or mental health concerns that I didn't see on site, they would average about 11.5 credits a semester and about 57.41 attendance hours a month. And then the students that do have identified mental health concerns that I did meet with on a regular basis ended up having an average of 14.8 credits and 76.5 attendance hours a month. So that's pretty exciting numbers for us.
So some of the successes of the program for the pilot project is that it qualified the need for on-site services for our young moms. We had low wait times, obviously, with Taylor on site, and even on a half-time position, it really worked well. Our young moms did not have to go off-site for counseling with, say, the city or and we do have a hard time with our young moms meeting with psychologists and psychiatrists off-site. It's an appointment it's very hard for them to get to, and secondly, there's no childcare. So we know that this is a really good thing. We created a barrier-free access. What we did before Taylor started was that we had a couple of noon hour presentations for the young women. There was some occupational health students that came in and did a presentation in regards to mental health, some awareness about let's talk about it. Then there was some campaigns in Canada. I remember who ran those campaigns.
Partners for Mental Health.
Thank you. Partners for Mental Health across Canada, and one of it at that time it was called Let's Call It BS, and that really helped the girls understand that it was okay to talk about their mental health to somebody within the school. So that again created a safe environment for them to approach the adults, and we know that the students meeting with the mental health professional, mental health recovery facilitator, developed a repertoire of practical skills. And we have some notes on that from our evaluation, because the pilot project included an evaluator, and we were able to do very small qualitative interviews with the moms, very small group, and they were able to reiterate some of the coping skills and tools that they had picked up from Taylor. The other piece that Taylor works really hard on in the program is the awareness of healthy relationships, and ironically, this isn't just with their partners or their immediate family, it's also with other adults in the building. So we're talking about other professionals and about identifying what boundaries need to be in place. We know that it's improved their attendance and their achievement at school. And it might seem that this is a part of the program, the achievement and the attendance, is not a part of this pilot project. It's part of another piece of the program that we offer in the school, that the students have to be at school 80% of the time. That's what they're supposed to strive for. So, and also they're able to access community supports through Taylor referrals almost immediately.
So I'll speak to a few challenges that we've seen in the year they've been there. So we clearly underestimated the need for the amount of support that's needed at the school. I mean, I see about a third of the students at the school, and if there could be 2 of me, that would be much better. And it would be great to have that outreach component as well, because some of the girls, if they're feeling so unwell, they're not coming to school, and then they're not accessing any support at all. Breaking the stigma around mental illness and receiving support. This has been spoken to in this conference already, but it's so tough for moms to say I need help or I'm not doing okay. There's a big culture in this school where, you know, lots of these girls, their moms weren't doing okay for them, and so they feel that they need to be. And so they really don't want to come forward and say that they've been struggling. So we want to break that stigma down, and, you know, use that analogy of the airplane air mask. You know, you have to put yourself in your own on before you assist another. Communication between partners involved in the project. So, like we said, we're based in a school, and teachers and the school administrative staff have different goals for the students than we do, and we need to sometimes we need to meet in the middle a little bit there, and that's getting better with each passing day. There's a clear need for more specialized support. I mean, I like through my intro, I have my undergraduate in psychology, non-master's and PhD level therapist, and I do as many referrals as I can, but it would be great if we had more specialized support on site as well, especially since a lot of these girls have very intensive trauma histories, and I'm not equipped to deal with that the way that it should be. We had some difficulty obtaining quantitative data related to the changes in mental health, and that had to do with a lot of factors, including starting late, not finding appropriate measures for the girls, and then having issues with just having them filled out and completed. So that'll change with the few coming years we have up. And during the pilot, I wasn't able to deliver mental health education sessions because of time constraints. But that's since been remedied. So moving forward, we have been approved for 3 years of funding, which is pretty exciting. So we're in our first year of our 3 years right now. We've developed some interdisciplinary medical team meetings. So instead of every service provider in the school just doing what they're doing, we all come together twice a year to talk and to communicate and to talk about best practice and see who's providing what, and just bridge those lines of communication. We've also started a project with CASA, Child, Adolescent, and Family Mental Health Services. During our Voices group, so our after-school group, we're actually going to have a child psychologist come in and do some education around attachment, and they're actually also going to work with mom and baby and fostering some attachment. We're looking into having some Masters of Counseling practicing students do their placement at Braemar. We have one that does her placement at CMHA, where I work, but that's downtown, and another that does hers at Terra's downtown office. So we want one at ours. I'm going to be implementing the outreach component this summer. The girls are in summer school in July, but not all the girls are, and August no one's in school, so that'll be a good time to kind of get the outreach off the ground and start seeing some girls out in the community. And there's been a huge demand for a post-Voices recovery group. A lot of girls want to either do the group again or do another group or do something. So we're going to try and create something that isn't the same, but where they can still receive support. Yeah. So, yeah.
Yes. Are there questions for these ladies and about their work? It sounds great.
Thanks. Yes, it's a lot of fun.
Well, that's a good thing to be able to say about your work. I think that you like it.
Yeah.
I think it's wonderful you got the 3 years funding, and now you can go and you can do the outreach. What do you think you're going to find with that? What are your sort of hunches about that?
I think it'll be really tough to actually start the outreach in the summer and then have to cut it off come September. But I think it'll just be a lot easier to connect with the girls that just are struggling so much that they haven't been able to make it to school or not as often as they would like to, and see what kind of interventions or support we can provide to the girls that are stick at home a little bit more.
Are you going to their homes? Is that how you're thinking of it?
It depends. We're going to do a safety assessment, and so depending on the outcome of that, then that will determine whether or not it'll be in the home. But Terra has an outreach program as well, and
So we meet, so we'll meet in the home or in the community or whichever the parent wants. And it's interesting, this piece of work offered in July and August. A couple of years back, we had started making connections, like for us that work at the school, we started continuing connections with our moms during Christmas break, spring breaks, and the summer holidays. And because what we realized was that during Christmas break, so many of them slipped off the rails and didn't pay their rent or got evicted or ended up back in a relationship that wasn't healthy. And then we had a really hard time getting them back into school and to the supports. So we're just finding that constant connection with them, and now we've even reverted to text messaging or emailing with them just to say, hi, how are you? It's just a check-in. It's just to let them know that we're around and we're able to connect with them if they need it. So, yeah.
Question: how many of the women that the young women that you're dealing with here, are the fathers to be still having a relationship with them? And just a follow-up before you even answer that question. How much does because I'm guessing not a lot, how much does that actually contribute to their anxiety and concern and their poor mental health around, like, the baby's gonna come,
Right.
and I'm gonna be by myself, or at least I'm not co-parenting.
Right. So yeah, I'll answer the second question first. Huge.
Okay.
Like really, the relationship with the father's boyfriend, whoever it is, it often dominates what we talk about in our sessions. It's a huge contributor to anxiety, stress, feelings of just being overwhelmed or not knowing what's to come. Fathers. Big topic with us. And I'd actually say that with the girls that I work with, maybe 60 to 70% of the women are still in a relationship with the baby's dad, biological father. Whether or not that's healthy is
Fair enough.
it's tough to say. But yes, I would I'd say with the women that are still involved with baby's dad, have a relationship with them, I'd say only about half of those relationships are healthy.
Do you include fathers in the program?
No.
Not in this specific project, but as Terra, we have our services for young dads, and we have male workers that'll work with our fathers, whether they're involved in a relationship or not. We have actually a couple of young teen dads that are single parenting, so they help them with housing, getting back to work, and or getting to work, or getting back to school, whatever it is that they want to do.
And I'll just add on to that. I've had a couple instances where I've had one of my clients has brought her partner in to. They want couples counseling or something. So what I'll really do is talk to them about what their needs are and then refer them elsewhere. So.
with regarding substance use, do you run into that and how is that handled?
Yeah, we have addictions counselor that comes on site too, the woman that I co-facilitate that group with, and so she does most of the addictions work. It's actually pretty amazing, but a lot of the girls that are struggling with addiction, as soon as they find out they're pregnant, they're done. Yeah, quick cold turkey, and whether or not the cold turkey thing's the best, but yeah, it's really incredible. We do not see as much addiction as one may think, but it's certainly there, and we have addiction counselors to.
I'm assuming that some of the families have child welfare involvement, and if part of that relationship fostering is helping support their relationship with their child welfare worker as well.
Yeah, we do the best that we can with that. It's difficult because we're in the school. There's this culture around child welfare, and it's tough to break that stigma too. A lot of the girls are very resistant to the help, and when it's brought in, or child services is called for one reason or another. Things get a little bit worse before they get better, but we do the best that we can. Education and doing collaborative work.
Just imagine that being tricky.
Yeah.
I know that you try to keep in contact with these young moms through texting or telephone, mobile phones, but do you ever use social media? Facebook, Twitter, in other ways?
We do, but it's program based. So we've allowed a few of our programs, like we have a leadership program at the school, we have a alumni program. We also have a literacy program, so we'll set a Facebook up per program, and it really is to communicate back and forth in regards to that program. We find that, and as you probably all are aware, Facebook is really bad.
Sure.
And we've had many fights in the school in regards to Facebook messages.
Yeah.
So yeah,
And even during the months where the girls are not in school because of March break or during the summer,
Right.
and those are ones who fall off the radar, have you considered turning to those aspects of social media to at least try to reach out when
Facebook?
Yeah.
No, we actually haven't, yeah.
I only raise that because I know in our child protection agency in Toronto, we've got specialized adolescent teams, and so there are inevitably teens who don't want to work with us and sometimes
Right.
disappear for long periods of time, and the only way that sometimes we end up finding them is through social media, and it's less risky, it's less
It's pretty safe,
and
yeah.
they get control of how they want to communicate with us, and at least that's the one link that we often end up having with these teens who are roaming the streets, couch surfing, and who are really high at risk.
Interesting. Thank you.
I do wonder about privacy and confidentiality.
Yeah, and you know what, we've even had that lesson just recently with regards to text message, because a lot of times the partners and the young women will share phones. And so, a little bit too much questions were asked on the text message, and it was in a family violence situation. So you have to be very careful.
Because that's what we were, in my agency in the U.S., Connecticut, it's very, like, we're just now kind of looking at the idea of the texting, people we work, the clients and whatnot, and we are emailing, and I'm like, I don't even feel comfortable with really doing that necessarily. I'd rather talk to them on the phone.
Right.
And with
we would
my work,
too.
that's what I do. Like, texting is solely about like appointment times or
Yeah,
busy
exactly.
moments.
Yeah.
Nothing major, just like
Right.
something quick, like, I'm still gonna see you today, your appointment's at,
Yeah, and if it's anything more than that, like, I think we should say, call me.
Yeah, exactly.
What about the families of these young girls? Do you involve them, or I haven't heard anything about them?
Right, thank you for asking that. We haven't, as an agency, included the family, the larger family, nuclear family. I know.
Is there a reason for that? Is it confidentiality, or what?
Yeah, the service has been there for the teen parent, but it really has left the parent or the teen parent out of the loop in regards to their support, excuse me, and then communication with their own child. And we have seen over the years that it may even, it breaks down further when the child comes in, the grandchild comes into the picture, and then the parent still wants to parent the teen who's parenting, and there's all kinds of challenges. So, amazingly enough, this conference has really opened my eyes in regards to, like I said to Taylor, looking at the whole family as we're addressing. And that'll be my piece to take back to management in regards to that. So thank you.
Any other questions? Very good, thank you very much.